Hello, everyone. Thank you so much for joining us for our Johnson County Health Summit. My name is Lauren Purvis, and I'm the Program Manager for the Child Wellness Team here at the Center for Children's Health. Please be aware that this session will be recorded and made available through website and social media links to inform and educate the public on this topic. At the end of today's summit, we'll have a facilitated discussion with our Center for Children's Health team, and you will be invited to unmute yourself to ask questions, or you can type your question in the chat box. Keeping in mind that if you choose to participate in an identifiable way, you acknowledge that your image and/or name will be recorded and are authorizing the use of your information in the recording as described. You have no obligation to appear or speak in the recording. You can turn off your video and participate under a different name should you wish to remain anonymous. And the recording of today's summit is protected by copyright law and is not to be copied. If you feel comfortable doing so now, please turn on your video at this time. So first, I'll go ahead and thank our elected officials today for joining us on the call. So Judge Harmon, thank you so much for making time to be here. And I'm not sure, I don't think there's anyone else on the call. All right. Well, for today's agenda, Becky Hale, the Director of Child Health Evaluation for the Center for Children's Health, will kick us off with the Cook Children's Commitment. And then the Honorable Roger Harmon will provide our formal welcome. After that, we'll hear about Cook Children's efforts to improve children's health in the region. And then we'll receive an overview of the Johnson County Alliance for Healthy Kids to learn how we're improving children's health locally. And a highlight of the day will be learning about the results from our most recent Community Health Needs Assessment and how Johnson County children are doing in the following topics: healthy lifestyles, mental health, and parenting support. After the data presentation, we'll take a short break before the award presentation. And after the presentation, there will be a 15-minute facilitated discussion, and then we'll finish up the day with a call to action and closing remarks. So with that, I'd like to introduce Dr. Becky Hale. Becky serves as Director of Child Health Evaluation in the Center for Children's Health. Her team oversees the research aspect of our Community Health Needs Assessment, evaluation efforts for the programs and coalitions led by the center, and various reporting endeavors to both internal and external audiences. Becky has worked for Cook Children's for a little over 10 years and recently completed her doctorate in education, with her research identifying the overlap of community-based strategies addressing tooth decay, obesity, and asthma among children and their families.
Thank you, Lauren. Happy to be here today. And Cook Children's is committed to serving the children and families in our communities. We're excited to bring you the results of our most recent Community Health Needs Assessment. And this needs assessment is one of the many ways that we fulfill our system's promise. Knowing that every child's life is sacred, it is the promise of Cook Children's to improve the health of every child through the prevention and treatment of illness, disease, and injury. In light of today's event and our needs assessment, I'd like to thank the leadership of the Center for Children's Health, Chris Pedigo and Marilyn Napier. I'd also like to recognize the work of the Child Health Evaluation team in overseeing the needs assessment research process, as well as Linda Fulmer, Courtney Bernard, Lauren Purvis, and Dora Garcia in the planning and coordination of our summit today. At this time, I'll turn it over to Dora, who will continue with our agenda.
Thank you, Becky. My name is Dora Garcia, Program Coordinator for the Johnson County Alliance for Healthy Kids. Our first speaker, Honorable Roger Harmon, was born and raised in the county seat of Johnson County. He attended Cleburne schools and also Hill and Tarrant junior colleges. He has been married for 54 years to the former Martha Heineman, and is the father of two grown children, Greg and Wendy. One of the greatest joys of his life are his grandchildren, Trevor, Tessa, Hunter, Marissa, and Mason, and a great-granddaughters, Arabella and Lilith. Judge Harmon has served as deacon in the Field Street Baptist Church and has taught adult Sunday school for the past 20 years. He is currently serving his 27th year as county judge. Prior to being the county judge, he successfully owned and operated Harmon Insurance for 20 years. Judge Harmon currently serves on many different boards in Johnson County, including past president of the Texas Association of Counties, County Judges, and Commissioner Association from 2012 to 2013. Past president of Texas Association of Counties, Northeast and East County Judges and Commissioners Association. Past chair of the North Central Texas Regional Transportation Committee and member for 20 years. Welcome, Judge Harmon, and thank you for being here.
Thank you, Dora. It's an honor to be asked to be here. This is a very special event today, and I want to welcome, I believe this is the 5th Johnson County Child Health Summit. Thank all of you for joining us today. COVID certainly has kind of put us back a step a little bit, I think, in some of the goals that all of us have had. This journey began back in 2009 when Cook Children's conducted an assessment of children's health in Johnson County. In 2011, community members across Johnson County came together and created the Johnson County Alliance for Healthy Kids to focus on improving the health and well-being of our children in our county. And from all the stakeholders that were identified, identification of healthy lifestyles was the primary health focus on this coalition. I always have a thought. My background before I was judge was sales. And I've always lived by an old saying I'd heard from a professor one time, is that you always go in the direction of your thoughts. And so what this coalition, in my opinion, does for each and every one of us, the goal is to have better health for our children. And so you always go in the direction of your thoughts. So if you put your thoughts in the direction of improving children's health, most likely you're going to achieve that goal. And I know that everyone that's present today has that in mind. And because that's what this coalition is really all about, is improving the health of our children. So I just want to thank each and every one of you. We have so many volunteers that get involved in day-to-day operations of different areas of our county. And we really have seen that during some times that we've had recently on the ARPA funding. We interviewed everyone that applied for money through this American Rescue Plan money. And it gave all of us an opportunity to see how many wonderful people that we have that get involved, Dora, in our county. And most of those people are volunteers, and they give of themselves. So we're here today, I think all of us are here today to have the number one goal, and that goal being let's improve the health of our children. I do want to say a special thanks to Kimmy Mcgrady. She's the president and chair for your ongoing leadership. So thank you so much for your dedication on this too, Nene. And I hope that you all have a wonderful summit today. And this office has always been open to help in any way that we can possibly help. So we have so many great people involved in this, Dora. And so thank all of you. I appreciate each and every one of you for making the lives of our children in Johnson County a better place. So thank you so very much.
Thank you, Judge Harmon. And Becky will join us again to lead us into the data presentation.
Thank you, Dora, and thank you, Judge Harmon. As we begin the data presentation, I'd like to highlight what a collaborative process our needs assessment has been this time around. And I'll share an overview of our assessment methodology, along with a few more specifics with our parent and community leader survey demographics. And then Blair Williams will present the data results for Johnson County. Next slide, please. So I'd first like to pause and recognize our numerous supportive community and research partners. I'd first like to thank you all for attending this event today. I know many of you helped share information about our parent survey with the families in Johnson County and completed our community leader survey or participated in an interview. So thank you so much for that. We appreciate your support in this endeavor. I'd also like to thank Linda Fulmer, our CHNA administrator. A big thank you to our research vendors who provided their expertise in collecting the data, ETC Institute, MHMR of Tarrant County, UNT Health Science Center School of Public Health, and the Center for Transforming Lives. I'd also like to recognize the many internal departments within Cook Children's who've been supportive of the CHNA journey this time around. And then for this assessment, we brought together an external advisory committee made up of community partners representing the 8 counties within our service area. And these partners met July of 2020 through August of 2021. They shared their time and insight with us as we were finalizing our parent and community leader surveys. They created a lot of awareness about the surveys during data collection, and some provided interviews. We had representation from all 8 counties on this committee, and I would like to recognize and thank Kimmy Mcgrady, Ruby Peralta, and Deanna Ochoa for representing Johnson County on this committee. We greatly appreciate their involvement and expertise. Next slide. So we expanded our methodology for our 2021 Community Health Needs Assessment. We conducted a household survey of parents and caregivers of children 0 to 17 from all 8 counties within our service area. And I think it's really important to note that this parent caregiver survey provides us with information from the parent's perspective, which is really insightful. But we also know that's just one piece of the puzzle. And so for that reason, we included additional methods of data. We held face-to-face interviews with families experiencing homelessness or with an undocumented family member. We held virtual focus groups with families to gain a deeper layer of understanding around barriers to access to care, COVID-19, and other prevention topics. We conducted a community leader survey and visited with more than 20 leaders for a more in-depth conversation around children's health issues in their particular county or community. And then finally, we reviewed local, state, and national data to fill in any gaps, look at trends or benchmarks, or provide any other additional insights. So I'd like to play a short video for you now, providing a little more information about this methodology.
Maintaining good health for North Texas families is not always easy. Many families face obstacles such as poverty, discrimination, quality education, housing, and unsafe environments. Addressing these hurdles requires a community-wide approach with a shared goal: healthy children. Everything we do at Cook Children stems from the promise we've made to our communities to improve the health of every child through the prevention and treatment of illness, disease, and injury. One way we keep this promise is through our Community Health Needs Assessment. Every 3 years through this assessment, we hear from parents and community leaders throughout North Texas. The valuable data revealed in this assessment becomes a shared rallying cry for community partners who collaborate with us to prevent illness and injury to children. The Center for Children's Health leads the Community Health Needs Assessment research and outreach services for Cook Children's. The center works to prevent injuries and illness and improves access to services for asthma, child abuse and neglect prevention, healthy lifestyles, injury prevention, mental health, oral health, and parenting support. A key element within our Community Health Needs Assessment is the Community-Wide Children's Health Assessment and Planning Survey. This is a household survey of parents and caregivers of children newborn to 17 to assess their perspective about children's health across our communities. The survey asks questions about how various health issues affect their children and how easy or difficult it is to obtain medical care. We want to know the parents' perspective on children's health. This survey, available in English and Spanish, is administered to parents and caregivers through mail, phone, and email. Because we care about the perspective of all parents within our region, we send the survey to a random sample of 25,000 households within our 8-county service area. We also intentionally survey families experiencing homelessness and families with at least one undocumented member. We're able to survey enough parents to have a high level of confidence in our survey results. Parents and caregivers in each county also participate in virtual focus groups to give us a deeper layer of data. These focus groups allow us to further learn about the unique challenges parents face with accessing medical care and social services within our communities. In addition to the parent and caregiver perspective, we survey and interview leaders throughout the community regarding their views on children's health. Additional children's health data from national, state, and local public health and academic sources supplement the findings from parent and community leader surveys. We bring all this data together to share with communities across our region. Together with community partners, we work through our various collaborations to determine the best avenues to address these complex issues. It takes all of us working together to clear a path to better health for all children in our communities.
We collected quite a bit of information this time around, and we would love to share additional details of our methodology efforts for those who might like to know a little bit more. And so for this reason, we created 9 separate FAQ type documents that outline many additional details of how we conducted our research. We'll place a link in the chat to our website where these documents can be downloaded. You may also reach out at any time through the email address chnafeedback@cookchildrens.org if you'd like to know more in the future. I also wanted to share that while we have conducted our parent survey, which is also known as CHAPS since 2009, we knew that due to COVID-19 and other variables that it was time to update our survey to better align our questions with the National Survey of Children's Health. And this helps us compare our results to the national and state results. And Blair will provide a little bit more of that information later in the results presentation. So we not only better aligned our parent survey questions to the National Survey of Children's Health, but we expanded our survey from households with children 0 to 14 to 0 to 17 to help capture more information around the teen population. We also included 2 additional counties, now surveying an 8-county region. And so because of these enhancements, it means that we want to be mindful of when we might compare our data from previous survey years. We can still do comparisons on some questions, but because of the additional data we've collected this time around, such as with the focus groups and interviews, we aren't focusing so much on the data from the previous survey years today. But we definitely recognize that this work is complex, and we know that progress is being made daily. Our parent caregiver survey methodology also included oversampling in counties with lower populations and then weighting the results by zip code to ensure that the geographic distribution of the survey sample was comparable to the actual distribution of the 8-county population. We used U.S. Census information to predetermine the number of responses needed to reach this representative sample based on the number of children living in each county. And we completed our target of 460 surveys in Johnson County. Next slide, please. So with our community leader survey, this particular survey is not representative of the population, but we did collect a very healthy sample size of 306 leaders from across the 8 counties. Leaders selected one primary county in terms of answering the survey, and around 5.5% of our respondents selected Johnson County as their primary county. We also asked what role they are involved in within their community, and they're allowed to select more than one role. The top 3 roles were the categories of health professional, social services nonprofit, and educator school official. And Blair will also share about some of these results in her data presentation. Next slide, please. So after Blair presents the results, Lauren will return and provide a final wrap-up of our data presentation. And before she begins, I'd like to share a little bit more about Blair. Blair Williams is a child health evaluation analyst at Cook Children's Center for Children's Health. For the past 15 years, her expertise and passion for public health has been focused on child and family health. In previous roles, she served as a community health educator, advisor to healthcare and school administrators, developer of family-centered wellness programs, and researcher for family wellness behaviors. Blair brings her experience, enthusiasm, and love for data to our community health needs assessments. She loves supporting Cook Children's and our community stakeholders so we can all bring joy and improved health to every child. At this time, I'll turn it over to Blair.
All right. Thank you, Becky, and thank you for that introduction. Hopefully the love for data and the passion for data comes through in today's presentation so that we can all come away with some really great takeaways that we could use in Johnson County to help improve the health of kiddos in Johnson County. So if you can go to the next slide for me, please. Thank you. Okay, so we're all here today, and I have the honor of going over the key data highlights for Johnson County. And we're all here, right, for the same thing. We want to help children and families in Johnson County. And so you'll notice there that HELP is actually used as an acronym. So there's many things aside from data that I love, and that's acronyms and puns. So I won't be painful and give you any puns in today's presentation, but I will give you a helpful acronym, and we'll explain that HELP framework in just a bit. But if you can go to the next slide for me. Perfect. Again, so we're all here because we want to help every child with their health needs. And in the video, you heard that we have 1.2 million children living in our 8-county service area. And in Johnson County, oh, my lights just went off. That's fun. Let's do this. We're getting activity in our daily routine. I like it. Okay, so how do we help every child with their health needs? Again, I said there's 1.2 million children across our 8-county service area, but in Johnson we have over 145,000 children, and it's a diverse population. So this data today will focus on that population. And if you can go to the next slide, we'll go through our data sources. And so as Becky mentioned, and of course in our video, we outlined many of those data sources in the new methodology that we included in our 2021 CHNA report. But for today's presentation, I just wanted to highlight what we are including and what we'll feature. The way that this data is presented is it's simple stats and stories that are both quantitative and qualitative findings from our Johnson County results. And that's meant to help you with your work. Some of this data might be known to you. Some of it may just be new information that's really helpful. But the idea is that we have this sample size that's large enough to represent the over 145,000 children in Johnson County. So that way you can estimate how many children might have a specific health need. And that might be really helpful to you as you do some program planning and coalition work. I'd like to also make that reminder that when we refer to caregivers and parents, they're really the same thing. We call it a parent survey, but we're surveying caregivers of all different types. So that could be grandparents, step parents, adopted parents. And so I really want to make that clear that I might use those terms interchangeably throughout the presentation, but we do have a diverse set of caregivers that we sampled with this survey. I'd also like to put the reminder out that this is Johnson County residents, that they're not only Cook Children's patients. That's another question that we typically get. So this represents Johnson County, the findings that we'll go over today. And the other piece is you'll see throughout this presentation that I will compare to national and state benchmarks. So you can see how Johnson compares at the national and state level. And in some questions, I'm able to show you comparisons from before the pandemic and during the pandemic. So that's really helpful with some of those metrics. And we'll also be able to explore those data equity gaps so we can have that informed knowledge when we do program work in Johnson County. And for any of the qualitative quotes, those are quotes from our interviews and our focus groups with parents and caregivers. I don't specify any identifying information, and that's meant to protect the identities of those who participated. We are so thankful to the parents, caregivers, and community leaders who who gave up some of their time to talk with us. So we want to honor that commitment to their privacy when we share those results. And lastly, there'll be some secondary data included in this just to provide some additional information and context behind some of our data points. Next slide. Okay. So from our 2021 assessment, when we looked at the health needs of children across our 1.2 million children population, we identified the following community health needs. That's oral health, mental health, healthy lifestyles, parenting and family support, injury prevention, asthma, and overall health and equitable access to care. This is across our 8-county service area, but it's also in Johnson County. We'll go over some of these findings today. And while these may all seem isolated and siloed health topics, the reality is that they're all connected. At the root of that is those social determinants of health. And so we'll get into that a little bit with each of our slides. So if you can go to the next slide. Thank you. And so if you haven't heard the term social determinants of health before, it's a term that's used often in public health and in community work, where the social determinants of health are basically factors of where you live or play or where you learn and how that impacts your overall health. And for children, it may impact their health in their present age, but it may also have an impact on them as they become young adults, parents, and age. So for children, we like to focus on where they live, learn, and play because those all have impacts on their overall health. And so if you can go to that next slide. With that in mind, we're going to come back to that HELP framework, that HELP acronym. And this helps us understand how healthy lifestyles is present in all of those community health needs that I identified on the previous slide. And we'll look at it through 4 different lenses, which is the health, environment, learning, and parenting and family support. So for health, we're focused on metrics and findings around equitable access to care and basic needs. For E, for environment, we're focused on safety where children live, learn, and play. For learning, we're focused on readiness and support for academic success. And for P, that's parenting and family support, where we'll bring all of that together and see how all of these metrics can really be enhanced and supported with that parenting and family support piece. Again, today is just high-level overview of all our data findings for Johnson County. They are simple stats and stories. And again, it may be useful to you in your current work. But if there is something else that I have piqued your interest and you want to explore more, know that we have a really wonderful data dashboard that's interactive, and you could visit and you could play with the Johnson County level data and see those results for your local level. And we also have those FAQ documents. So if you have any more questions around methodology or some of the metrics that we use, you can review those FAQ documents. And so let's go ahead and get started. If you can go to the next slide. Perfect, thank you. So for our first section of our HELP acronym, we're focused again on health, and that's equitable access to care and basic needs. And in this section, we're going to look at the health status, oral health status, and mental health status of children in Johnson County, as well as the BMI for age, access to preventive care, not only for their physicals and well child visits, but also for dental care, and access to basic needs such as food and housing. Next slide. So for this first slide and our first look at health in Johnson County, we're looking at the health status, mental health status, and oral health status of children in Johnson County. Now, these findings are based on the results of our caregiver survey. So this is based on what parents are telling us about their children. And the questions that we asked these as 3 separate questions. They had 5 choices. They could rate their child's health either as excellent, very good, good, fair, or poor. We identify ideal health status as those that selected excellent or very good. And this is a way of conveying that information, but it's also in alignment with the National Survey of Children's Health. So we're able to compare these results at the national and state level during and before the pandemic. So as you can see, most children in Johnson County have excellent or very good health, mental health, or oral health. That's 9 in 10 children with excellent or very good health. 7 in 10 children that are ages 6 to 17, more of that school age group, have the ideal mental health status, and 7 in 10 children ages 1 to 17 have the ideal oral health status. And we'll explore these more in the next slide in more detail. Next slide. So for health status of Johnson County children, again, we asked the caregivers to rate their child's health on that scale of 5 points. 9 in 10 children have excellent or very good health according to their caregivers. When we compare this to the local rate, which is our 8-county rate, and the US and Texas benchmarks, we see that it is higher than the local rate, and it is consistent with what we're seeing at the national and state level before and during the pandemic. Now, that 1 in 10 children, that equates out to about 15,000 children in Johnson County that either have poor, fair, or good health status according to their caregiver. And if we look at this ideal health status by age group, you could see there that there's a lower percentage of children with that ideal health status in the 6 to 11 age group. And then for a preventive well child visit, which of course is an opportunity for a parent and a child to connect with that caregiver, or excuse me, that healthcare provider, and speak to them about their child's development, any health concerns that they have, getting them connected with really needed resources or social resources. We see, again, that 6 to 11 age group has the lower percentage of having received that well child visit. Next slide. Next is mental health status in Johnson County. And here again, we're only looking at school-age children ages 6 to 17 on this one. And so 7 in 10 children have excellent or very good mental health, according to what their caregivers told us. Now, this question is not on the national survey, but we added it so that we can monitor this over time, just given the pandemic and being able to track this. So we don't have a benchmark prior to this 2021 CHNA, but it is a metric that we will monitor. This rate here for Johnson County is consistent with what we're seeing locally across the nearby 8 counties. And if we look at the remaining children that don't have that ideal mental health status, according to their caregivers, that's 28,000 children that are ages 6 to 17. And if we look at this in age groups, of course, we're only looking at 6 to 17, so 0 to 5 age group is not presented here. But we see that that rate of ideal mental health status is lower in that 12 to 17 age group. And we'll explore that more. But if you can go to the next slide, we'll look at oral health status. And so this, again, was a question that was on our caregiver survey, and we asked caregivers to rate their child's oral health status. Same 5-point metric where we're looking at excellent, very good, good, fair, and poor. And 7 in 10 children have excellent or very good oral health, according to what our caregivers told us. Now, this is slightly lower than what we see at the local rate, but it is fairly consistent with that local rate. And we do see that our local rate and the Johnson County rate are lower than what we've seen at the US and state level before the pandemic. But if you see those metrics at the bottom there on the bottom left, there was a slight decrease even at the national and state level during the pandemic. And we'll get into that in a couple more slides. But for now, let's look at the 39,000 children that don't have the ideal oral health according to their caregivers. If we look at the ideal oral health status rate by age group, we see again that 6 to 11 age group has a lower rating compared to the other age groups. And what's interesting here is that third bullet there where it says received a preventive dental visit by age group. We see that the 1 in 5 age group was less likely to receive a preventive dental care visit, which is interesting because we see that 6 to 11 age group has more of or less ideal oral health status. So what that means is the importance of preventive dental care in those younger ages may be helpful in preventing some of the dental problems or dental concerns we see in that 6 to 11 age group. Next slide. This next slide is based on BMI for age. If you're familiar with how BMI is calculated, children's BMI is calculated differently than it is for us adults. For children, we're looking at their height, weight, age, and gender in order to calculate their BMI. And you're probably wondering why I only am showing you ages 10 to 17 on this slide, right? For this, we follow the National Survey of Children's Health. They use ages 10 to 17 as their benchmark because they did a really interesting study when they looked at a comparison of self-report or parent-reported height and weight compared to what was physically measured. They saw that parents of children below the age of 10 frequently underestimated or overestimated their child's height and weight information. So for best estimate of BMI, when we're using caregiver self-report, we look at ages 10 to 17. So with all that in mind, now we can go through the results, right? So for children in Johnson County, nearly 6 in 10 have a normal BMI for age. This is based on 4 categories where they're either underweight, normal weight, overweight, or obese. And so nearly 6 in 10 have a normal BMI for age. Now, according to what we heard from caregivers based on height, weight, age, and gender, most children in Johnson County have a normal BMI. However, 37% are overweight or obese, and 6% are underweight. Now, this chart is here so you can see how this compares to our local 8-county rates, also Texas and United States during the pandemic. This rate for Johnson County, and when we look at the same rate across our 8-county service area, we see that Johnson County is consistent with non-urban areas, and it's also consistent with what we're seeing at the Texas state level. So that's information there for good comparison. And when we estimate the population that has an overweight or obese BMI for age, we see that it's over 25,000 children that are ages 10 to 17 that do have that overweight or obese BMI for age. And as we explore this further and look at the concept of social determinants of health, we'll see how income, where children live, learn, and play plays a role in this. And we'll also be able to connect some of this to mental health when we get into that section. Next slide. Now, what could possibly support all of the previous slides and the health status information that was previously presented is access to care and receiving care. And so for this metric, we're looking at the percentage of children that receive all of their needed health care in the past year. This is also a question that's on the national survey. So we're able to provide that benchmark for before and during the pandemic. And we see here that 7 in 10 children received all needed health care. And this is including their medical, dental, and mental health care. But when we compare that to our local level and our national and state, we see that that 70% is consistent with what we're seeing at the local side, but it is much lower than what we're seeing at the national and state levels. The national and state before and during the pandemic are in the 90%, whereas local it's 70%. So it's a bigger population of children that aren't receiving all of their needed health care, and that could influence their overall health and their well-being. Now, if we put a population estimate to how many children did not receive all needed health care in Johnson County, we see that that is over 43,000. And there was a follow-up question on the caregiver survey where we asked them why their child was not able to get all of the needed health care. Most common response was COVID-19 pandemic, followed by the insurance was not sufficient to cover the cost of care. So they may have had insurance, but it wasn't enough to cover the out-of-pocket expenses, or the services weren't available in the child's area. And we'll explore that more. See, this is my get your movement in. This is perfect for a healthy lifestyles focused coalition, right? And if we look at the foregone types of care, for the population of Johnson County kids, we see that most of it was 21,000 or 15% of children did not receive all needed dental care, followed by 18,000, which is 12%, did not receive all needed medical care, and 11,000, or 7%, did not receive all needed mental health care. And we'll explore this more as we continue. Next slide. And to the point where insurance may not have been sufficient to cover the cost, we'll now look at how many children, or the percentage of children who have insurance coverage. This is a metric that we have on our 2021 CHNA, and it's in alignment with the national survey, so we can compare the results at the national and state level. And the question that we asked on the survey was, at any time in the past year, was this child ever covered by any kind of insurance? And they had 3 response options, which is yes, child was covered all 12 months, or yes, but there was a gap in coverage, or no. And so for this 9 and 10 children stat, this is continuous health insurance coverage, meaning they had coverage for all 12 months. Now, this rate is consistent with what we're seeing at the local rate and at the Texas level, but it is different than what we're seeing at the national level. And when we look at this, this finding, we see that it's over 13,000 children in Johnson County that did not have continuous health insurance coverage, meaning they either had a gap in coverage or they're uninsured at the time of survey. And with that, there was a follow-up question where we asked caregivers to tell us what were the reasons why their child was uninsured. Either it was a change in employer or unemployment. That was 60% of those that had responded that they were uninsured or had a gap. And that may be primarily due to changes in COVID, because we left it other response. And some of the comments were, my job had a change, or I lost my job due to COVID. So that played a role in that. Others said dropped coverage because it was unaffordable, or they had problems with the application or renewal process. And so just thinking of those 3 things, and how if a child has a gap in coverage because of these 3 factors, how those same 3 factors may influence their health, their access to food, all those other factors that we will get into in just a bit. Next slide. And so what you see with all these previous slides is this continuous theme of social determinants of health appearing. Access to food, access to healthcare, getting preventive care, things like that. And so taking a look at what our community leader survey results tell us, we saw that same theme of social determinants of health. And on a survey of over 300 community leaders from our 8-county service area with different backgrounds, either health, academics, working with schools, nonprofit organization, business leaders, public health experts. It's a very diverse ecosystem of leaders that responded. We see that over 60% of those leaders felt that poverty and affordable housing were serious problems for children in their communities. Now, part of this could be exacerbated by the COVID pandemic because of those factors. Maybe it made housing less stable or unavailable for some, or even changes in employment. But a quote from a community leader interview said, "The challenge is equitable access to health and healthy food, and there are populations with even greater needs because of COVID-19. And that's something we could probably all agree on, is that the pandemic certainly exacerbated equity gaps in our communities. Next slide. Okay, and so this concept of social determinants of health, where you live, learn, and play, played again in our parent focus groups. We heard from parents that some of them had to drive 40 or more miles just to get their child to the provider that they needed, or to find a provider that accepted their insurance. And so from this quote from a parent at a focus group, we see that they have to drive 30 or 40 miles from their house just to see a doctor, because the doctors in the area don't take their insurance. And it makes it extremely difficult, especially if they didn't have reliable transportation. Other things that came up in different focus groups or community leader interviews is that if they had transportation, they may not be able to miss work or school. to be able to go to those appointments. And that, again, was something we heard from parents, that if they had to miss work or miss school, it made it difficult to be able to go get that care. And from a parent at a focus group, even a nurse and front office lady made remarks to this parent about how much their child had to miss school due to medical appointments. And lastly, another common theme that appeared from our community leader interviews and our parent focus groups is that families may be fearful of getting care or services because they were afraid it might result in being reported to CPS or being deported in some cases. And so populations that may have higher needs are more hesitant to seek out those services. And you could hear from a community leader interview where some facilities don't see children and others have very specific criteria to go there. And that may also be a limiting factor for some children and families to receive the care they need. Next slide. Now, this is where secondary data also comes into play, because we could look at the U.S. Census data and see that the median family income of households with children in Johnson County is $70,000. This is based on 2019 5-year estimates. So on our caregiver survey, we ask the caregivers to provide their income levels, and it's different ranges. There's 8 different categories. And so for here, I'm just breaking it up into 2 categories for simplicity of reporting. We're looking at children in Johnson County with household incomes below $75,000 versus those that have $75,000 or more. And there's over 50,000 children in Johnson County that live in incomes below $75,000. And when we compare the children in the lower bracket of these 2 categories compared to those with $75,000 or more, we see that they're less likely to have the ideal health status we mentioned, ideal mental health status we mentioned, ideal oral health status, or continuous health insurance, less likely to have the normal BMI for age, access to nutritious foods, and access to physical activity. Those last 3 are really important to healthy lifestyles and the work that the coalition does, because this is where children, you could see the bigger gaps here. So children in 75,000 or below household incomes, much less likely to have those normal BMI for age, access to nutritious foods, and that physical activity. And that plays a role in promoting healthy lifestyles. Next slide. And so that wraps up the health section of our HELP acronym. Of course, we'll explore more in the next slides, but as we wrap up the HELP acronym, it is the equitable access to care and basic needs. And we highlighted some of the needs here for Johnson County, but we should also highlight some of the positive. And we heard many things from community leader interviews that all kind of center around this one quote here, which was the pandemic impacted basic needs and food, but our community really stepped up to the plate, and churches and programs helped young kids with food and adults who may have lost their jobs. And so there was this sense of pride that the community saw this need and filled that gap with various resources, collaboration, partnerships, etc. And so that just really highlights and speaks to the needs in the community, not just for Johnson County, but across the state and even locally, which is the importance of equitable access to care and also those basic needs such as food and housing. Next slide. Okay, so we finished the H part of our HELP acronym. So now we're moving into the E, which is the environment, and that is safety, where children live, learn, and play. Here we'll look at ER visit due to an accidental injury. We're also looking at adverse childhood experiences and neighborhood and school safety. Next slide. For our first slide, we'll look at accidental injury. We have a question on our caregiver survey where we asked the caregivers if this child had received emergency care due to an accidental injury. They could say yes or no. And based on that question, we see that nearly 1 in 8 children in Johnson County have received emergency care for accidental injury. And that's just over 16,000 children. Now, when you think about this stat, you also have to remember that this is children who are injured and received care. there could be a number of children that were injured but did not receive care. And so we don't have that estimated population. But we could supplement this with secondary data and look at what are the leading causes of unintentional injury, death in the US and Texas. And it varies by age. So for infants, primary cause of unintentional injury death, and this is again, unintentional injury death, is suffocation due to unsafe sleep environments. For children, children ages 1 to 4, it's drowning. For children 5 to 17, it's motor vehicle traffic accidents. And for young children and teens, that age group of 0 to 5, and then that kind of 12 and up, we see that poison and firearm injuries are more common. And to supplement that with our qualitative data from what we heard from parents and caregivers, it was really interesting because parents and caregivers had this kind of idea and notion that it just happens. You either look away for a moment and it just happens. Whereas community leaders said, no, they need car seats, they need life jacket stations, they need all these things that help prevent. And that might include lock boxes for medication or gun locks or things like that. So it just really shows how community leaders view it a little bit differently than what parents view injury prevention. Next slide. This slide here, it focuses on ACEs, and ACEs is a term you may be familiar with. If not, it's an acronym, and ACEs stands for Adverse Childhood Experiences. And these are events that could happen in a child's life that are potentially traumatic. And they could be things such as a parent's divorce, a death in the family, witnessing violence, drug use, or living with somebody that has severe mental illness. And this is a term that also signifies that if a child had multiples of these adverse childhood experiences in early childhood, then it also plays a role in their overall health as a child and also as they become an adult. So this was the first time on our 2021 CHNA that we included questions around adverse childhood experiences. And we're able to benchmark this with the national survey so we could see how our local rates compare to the US and US and state estimates. And in Johnson County, 1 in 8 children has 2 or more of these adverse childhood experiences that I mentioned. That's an estimated over 17,000 children. And if we look at these by ACE type, so we measured 8 different ACEs on our parent survey. The most common in Johnson County was parent or guardian divorce. That's 21% of children have experienced that. Followed by lived with anyone who had a problem with drugs or alcohol, lived with anyone that was mentally ill, suicidal, or depressed. Now, those are both bolded because on our community leader survey, we asked the same questions, but in a different way. We asked, how much of this is a problem in your community? And the community leaders identify those 2 bolded ACEs as the most pressing and most concerning ACEs in their community. So we could see here that the top 3 ACEs in Johnson County are listed there, but we also have parent or guardian served time in jail at 6% of children, and witnessed violence in the home is 6%. The others that aren't listed on this slide are less than 3%, and those are witnessing violence in their neighborhood or caregiver death. Or discrimination. Now, how does this compare to our local rate and our national and state estimates? So we could see that this 12% is slightly lower than what we're seeing across our nearby counties, and it is lower than what we're seeing at the national and state level. From our qualitative results, we see that, and this was a common theme of leaders that were interviewed, they felt that the pandemic itself was an ACE, and that just the pandemic and being isolated for a while could be a source of trauma for children. Others said that this really ties into everything else that they're tackling in the community, which is risk behavior or substance abuse or mental health. And others said that children, when they come to the classroom or come to school, if they're showing signs of stress or depression, it might be as appearing as fighting or acting out in the classroom. So this all connects with some of the other topics that we talk about. Next slide. And if we look at this by income, again, we broke the income by 75,000 or below, or 75 and up. So if we look at this, we see that children in income with 75 or lower, they are more likely to have 2 or more ACEs. They're less likely to feel safe in their neighborhood, and they're less likely to feel safe at school. From community leader interviews, we heard things around just the pandemic being disruptive to housing and how that plays a role in ACEs and safety in the neighborhood, or just that feeling of security. And so if there was more children and families having to couch surf or live in shared housing because that was what was necessary, that posed a potential safety problem for children. And those that were crowded while also having issues of sanitation or mental health, or even just safe sleep environments, might be difficult for newborns or young children. So social determinants of health plays a role, of course, in child safety. Next slide. And so as we wrap up the environment section of our HELP acronym, again, another positive quote, recognizing the increased need for child safety, especially during the pandemic, that the community was engaged and did a great job, not only trying to combat food insecurity, but rental assistance to families that needed it. And also child advocacy centers saw an increase in case volume, and that was to be predicted. But they were all high functioning and did a great job of responding to the needs of children and families in their communities. So again, that just highlights the needs around environment and that safety where children live, learn, and play, which is that equitable access to care if they need it for emergency or injury services, access to safe, stable housing and food, and parenting and family support. Next slide. Okay, so for our next section, which is learning, we're looking at readiness and support for academic success. This includes various metrics of school readiness. Again, this is almost timed perfectly with each section. I like it. We have readiness and support for academic success, which includes the following metrics of school readiness, developmental delay, learning disability, mental health, coping skills, resiliency, and self-regulation, and mental health and healthy lifestyles. You'll see that there are age-specific metrics here, and we'll explore that more in the next slides. Next slide. So first, we'll look at school readiness. This is for children ages 3 to 5 in Johnson County. We asked a question on the Caregiver survey where we could ask about their confidence in their school or their child's school readiness based on their developmental status of growth and skills. On this question, there was 4 different response options. It was completely confident, mostly confident, somewhat confident, or not at all confident. And this is alignment with the National Survey of Children's Health. So 76% of children ages 3 to 5 in Johnson County are developmentally ready for school based on their caregiver's perception of growth and skills. And when we compare this rate to our local 8-county rate, we see that it is higher than what we're seeing at nearby counties. And this is similar to what we're seeing at the US level from before and during the pandemic. Now, for the other need here is that this is just under 6,000 young children who may not have school readiness, according to what their caregivers told us. And to supplement this with what we heard from our qualitative findings, another theme that was present from what we heard from parents and community leaders is that because of some of the social distancing, many children may not have been in a structured learning environment to have that opportunity to socially develop their skills or learn classroom structure. It also was a missed opportunity in some cases for teachers to recognize some concerns and raise them with parents. And so that plays a large role in understanding childhood development or even getting them necessary referrals or screening. Next slide. So for this one, we're looking at ages 3 to 17, and this is based on what a healthcare provider or educator may have told those caregivers. And so looking at this, we have children, again, ages 3 to 17. 15% of children may have a developmental delay based on what caregivers told us from a healthcare provider or educator. And 16% of children ages 3 to 17 may have a learning disability based on what was told by a healthcare provider or educator. Now, again, this is based on parent perception. This is based on what parents are telling us. So that's just another consideration when we're reviewing these data points. But when we focus or when we bring those common themes from our focus group, we see that parents also may not know when or where to seek assistance if they had any concerns about their child's development or learning disability. And this isn't unique to Johnson County. This was across our 8-county service area. And so awareness of those resources may be of help to some parents. Next slide. And if we look at child mental health in Johnson County, we asked a series of questions on our caregiver survey asking if the child had ever been diagnosed by a healthcare provider with anxiety, depression, multiples of other mental health concerns. But what we saw at local level compared and likewise with the national and state estimates, the most common types of mental health conditions that were diagnosed were anxiety, ADHD, depression, and behavioral and conduct problems. And so if we look at that as a whole, here in Johnson County, 6 in 10 children do not have at least one of those 4 common conditions that I just mentioned. As again, this is based on what caregivers tell us and is a diagnosis from a healthcare provider. When we compare that at the local level and the national and state, we see that 35% of children have at least one of those common diagnoses that I mentioned. And that is higher than what we're seeing at the local rate, which is 31%. And it is, like the local rate, much higher than what we're seeing at the national and state level, which is in the 20s. Now, 35,000 children ages 6 to 17 have at least one of these common diagnoses. And if we look at this by income and by age group and by ACEs, we see that these diagnoses are highest in incomes below 75,000. They're highest in children ages 12 to 17, and they're highest among children with at least 2 ACEs. And from what we heard from community leader interviews across the 8-county service area is that the pandemic has tested mental health across the board, and just the importance of basic needs and resiliency is key. And that again connects to many of the factors we've already discussed, but it's also resulted in many focusing on suicide prevention and having resources and programming available for that for children and families. Next slide. Okay, so for our next slide, we're looking at these estimates of the most commonly diagnosed conditions that I just mentioned. We're looking at the 4 most common that are not just in Johnson County, but also at the national and state level. And in the gold bars, those are Johnson County estimates based on our caregiver data. And the blue is Texas before the pandemic, and the gray is the US before the pandemic. Now, state level data for during the pandemic is not yet available from the National Survey of Children's Health, so we're using the pre-pandemic data as a benchmark. And we could see that if you look at these 4 different categories, that anxiety is the most common diagnosed mental health condition of children ages 6 to 17 in Johnson County, followed by ADHD, behavioral conduct problems, and depression. When we reflect on this, just as a reminder, this is based on what caregivers tell us. And if they don't have access to care to receive a diagnosis, then that would also impact estimates, not only locally, but across the US and state. Next slide. And we'll also look at some protective factors. So we mentioned that these are some of the estimates of the most common mental health conditions, but we also could look at protective factors of coping skills and resiliency. And this is based on multiple questions on our caregiver survey. where we ask caregivers to rate if their child would always, usually, sometimes, or never demonstrate these 3 qualities. Show interest and curiosity in learning new things, work to finish tasks that he or she starts, and stay calm and control when faced with a challenge. These are 3 behaviors that were indicated by the National Survey of Children's Health to demonstrate that resiliency and self-regulation that would be helpful with coping. So we asked the same question on our caregiver survey to be able to measure that sense of resiliency in children. And so on the right, you see this bar chart here. The first 2 bars are United States before and then the during pandemic data estimates. The blue, the darker blue, kind of a teal, are the percentage of children that have 3 coping skills, meaning they always or usually demonstrate all 3 of those things. The lighter blue are those that have 2 of those skills that I mentioned, and the gray is 0 to 1. So we could see that there was a slight decrease at the national level between the before the pandemic and during the pandemic, and Johnson County is slightly below that. But what that tells us is that nearly 80% of children in Johnson County who are ages 6 to 17 have 2 to 3 coping skills that may demonstrate resiliency and self-regulation. So the quick version of that is 80% of children are demonstrating some resiliency and coping. And while it's really easy for us to think of all the negative things around mental health, to me that just really stands out as a positive and something worth reporting and sharing. If we can go to the next slide. Now, if we explore this mental health and how it's connected with healthy lifestyles, we look at the 8-county level data for some of this because the sample size is larger and we can do interesting crosstabs. But at the 8-county level, we analyzed healthy lifestyles behaviors of those school-age children, ages 6 to 17, and looked at that based on the children that had at least one of those common mental health conditions versus those that did not. And when we looked at the healthy lifestyles, we see that the children who had at least one of those mental health conditions were less likely to eat their fruits and vegetables following the recommendations, less likely to have the mandatory restriction on entertainment screen time, physical activity guidelines, having the 8 hours of sleep every day, and having a family meal on most days, which there's a lot of evidence and research that shows that having a family meal is a protective factor for children. And so access to nutrition, physical activity, this again is a protective factor, not only for mental health and child resilience, but also for healthy lifestyles. And one of the common themes that appeared in our community leader interviews was the importance of recognizing the role of social media in child mental health, but also the availability of outdoor resources or activities for children, making sure that they're accessible and affordable for families so that they can participate. Next slide. So this will wrap up the learning section of our HELP acronym. And again, the L stands for that learning piece, which is readiness and support for academic success. Again, many positive quotes that came from our community leader interviews. And some schools recognize the importance of meeting social needs in order to help children be successful in the academic environment. So they assigned social workers to their campuses to help provide getting connected to those needed resources. And again, that all highlights the importance of developmental screenings, mental health services, access to safe, stable housing and food, parenting and family support, and resources to support coping, resiliency, and suicide prevention. Next slide. And so we're on our final section of our HELP acronym, which is parenting. And this is the parenting and family support. We have caregiver coping with parenting demands. Caregiver has a source of emotional support, and caregiver's awareness of community resources. And as a gentle reminder, if I'm using the term parent and caregiver interchangeably, they're the one and the same because we made an intentional effort to capture various caregiver types when we did this survey. Next slide. Okay, so our first metric we looked at was parent coping. We asked how well the parent is coping with the daily demands of parenting. And it's based, response options are based on a 4-point Likert scale where they could select very well, somewhat well, not very well, or not well at all. And so here, this 50% of children is the caregivers who selected very well for coping day-to-day with day-to-day demands of raising children. Now, I'm going to skip to this needs and gaps where it's over 4,000 children have a caregiver who is not coping very well or not well at all. Those are the two lower sides of our scale for this question. Now, this rate is similar to what we're seeing at the local rate, but it is lower than what we're seeing at the national and state level. And there are multiple factors that could be contributing to that aside from the pandemic. It could be financial stress, emotional stress, or just worrying about providing for a family. And if we look at this rate of not coping very well, so this is taking a look at children who are coping somewhat well, or excuse me, caregivers who are not coping somewhat well, not very well, or not very well at all, we see that children, again, ages 6 to 11, under 75,000, having at least one mental health condition, and having 2 or more ACEs, being those populations with the greatest needs. So that just really supports some of the findings in our previous slide. Next slide, please. Next, we'll look at emotional support in Johnson County. This is for caregivers. We asked caregivers to tell us if they had a source of emotional support to help with parenting demands. They could either answer yes or no. So 90% of children have a caregiver who has a source of emotional support. And for those of the caregivers who said they did, we asked a follow-up question, where did they get the support from? And the most common sources were other family member or close friend, a spouse or domestic partner, place of worship or religious leader, healthcare providers, or a peer support group. And this is similar to what we're seeing at the local rate, but it is much higher than what we're seeing at the national and state level. So large source of emotional support for caregivers in the Johnson County and local counties. Now, if we look at the opposite of this, there's nearly 14,000 children in Johnson County that have a caregiver who does not have an emotional support for parenting demands. And for single parents, again, a common theme that we heard in our parent focus groups were that if they're single parents, it was difficult for them to find that source of emotional support. This particular quote shows the importance of church group meetings as that source. And so that's where this particular parent received that. Others were single parents and said, I am exhausted. I work all day and I have to come home and cook, being exhausted. And the kids need a lot of attention. So that just plays a large role, not only in healthy lifestyles, but many of those protective factors that we've mentioned in previous slides. Next slide. We'll look now at awareness of resources in Johnson County. We asked caregivers to rate their level of awareness of the resources in their local community. We asked it for dental services, healthcare services, mental health, and 211 hotline. They had 4 different options. They could select very familiar, somewhat unfamiliar, or not familiar at all. So the dark blue is the percentage of caregivers, the percentage of children with caregivers who are very familiar with those resources. And the lighter blue is somewhat familiar. So if we quickly look at this, we see that the blue shows that dental services and healthcare services are more familiar with caregivers versus the mental health services and 211 hotline caregivers have less familiarity with those resources. And if you're not familiar with 211, it's a great hotline where families could call and get connected with local resources, where to get food, housing, support in the community, etc. Next slide. And we also can tie this kind of family support, this parenting support piece to the healthy lifestyles and the importance of it. Because access to physical activity, nutritious foods, and family support certainly helps children achieve that overall wellness and well-being. If we look at this in terms of accessibility to physical activity and nutrition, we see that 2 in 3 children in Johnson County live in areas with nearby sidewalks, parks, or recreation centers. That also means that 1 in 3 children don't. And so that's an estimated 49,000 children in Johnson County that have limited access to physical activity simply near where they live. Now, if we look at this by obese and overweight children compared to children with normal BMI, we see that 57% of those overweight or obese children don't have nearby access, which is far less slower than those that have a normal BMI, and that's 70%. Now, when we think of access to nutritious foods, 3 in 4 children live in households that can always afford to eat nutritious foods, which means 1 in 4 don't. And that's an estimated 33,000 children that don't have access to nutritious foods. Now, if we compare again this BMI classification of overweight, obese compared to children with a normal BMI, we see again that same equity gap, which is children with overweight, obese BMI have less access to nutritious foods compared to those with a normal BMI. And a parent and focus group really summed that up much more nicely than I could, which is to say that we're promoting all this healthy lifestyles, but if parents can't afford to get that healthy food or that physical activity, then it just creates a snowball effect for children. Next slide. And so that wraps up the parenting section, of course, which is our last letter of our HELP acronym. Again, while that highlighted many of the needs for parenting and family support, we did see that community leader interview common theme, which is there was this recognition of a need and organizations were pulling together and collaborating. And in that process, identified new community resources they may not have known before, and were able to connect that many more families with those resources. And that really highlights the need of awareness of parenting and family support resources, equitable access to healthy food and physical activity, and equitable access to family-centered healthcare to involve the parent in making sure it's a welcome place for children to receive preventive care. Next slide. And so now that we've wrapped up our HELP acronym and we've covered health, environment, learning, and parenting, we've covered quite a bit at a high level. You could see that all those topics we talked about, but they were all connected through that center, which is that social determinants of health, and having equitable care and access to resources certainly plays an overall role in child health and well-being. And with that, just another reminder, we covered this at a high level. And if you have any questions, of course, we have the facilitated discussion, but we also have some resources through your FAQs, our data dashboard. And if you have any questions related to the results of our CHNA, you can also reach out to our family. And it looks as though it's already in the chat, which is great, but you can email us at chnafeedback@cookchildrens.org if you have any questions regarding the data. And with that, I will turn it back over to Lauren, who will help us through our next physical activity of turning the lights back on in our conference room. And Lauren, it is now your turn to do your physical activity.
Thanks, Blair. That's probably better than all the coffee I've been drinking today. I hope Blair's been able to give you guys some new or validating insights to think about. We've been really excited to share all this information with you all. And so, like Blair said, feel free to put your questions in the chat, and we'll address those after the break. So Terry has put up a screen here for us to recap some of Blair's presentation. And so you can see for children's health needs, preventive care for health education, community resources, and social support to support child health and well-being is needed in Johnson County. For children's environment needs, safe, stable, and nurturing environment to reduce risk of physical or emotional harm. And then children's learning needs, they need preventive care, developmental screenings, behavioral health, or social services to support academic success. And then parents in Johnson County need help with addressing social determinants of health, such as access to basic needs, healthcare, or safety, with social and emotional support for families. So before we go into a break, I'd like to just let you all know which questions we'll be discussing in the facilitated section. So you can see them here on the screen. So based on the data presentation, what resources are available for families in Johnson County related to healthy lifestyles? Go back one. Here we go. Based on children or families your organization serves, what types of community resources do families need most? And are there collaboration opportunities for providing or sharing these resources? And then what other organizations need to be at the table to improve children's health in our community? So again, you can think on these as we go into a break, or if you have some immediate thoughts that you'd like to share now, feel free to put them in the chat, and then we'll address those once we hit that facilitated discussion section of our agenda. So we'll have a 15-minute break, and we'll come back around 10:40.
Welcome back, everyone. So we're going to get started with a video. Earlier, we saw a video about why we conduct a community health needs assessment and the different methodology used. We would like to now present a second video that that shows what we do with the data and how important our community coalitions and partnerships are to the entire process.
How do you improve the health of 1.2 million children spread across 8 counties? Well, it takes a lot of planning, a lot of collaboration, and it takes a lot of support from people like you. Every 3 years, the Center for Children's Health pulls together important data from the public through the Cook Children's Community Health Needs Assessment. That information helps us to build strategies to meet our region's most pressing needs through our programs and through our coalitions and community partners. We then work diligently to track our success. Are we all moving the needle like we want? Are we making a difference? This work is bold and big. Change at the community level often takes decades to fully integrate, but progress is being made daily through all our dedicated partners working together. We report on our progress annually to the government, state and federal, as well as to Cook Children's leadership and other internal departments. We also celebrate this progress with our collaborative partners and build on the collective wisdom our shared experience provides. Although we've always used data to drive our work, our first formal community health needs assessment in 2009 and the assessments that have followed validate the work we do through our collaborations and programs. Data also guides us on how and where we do our outreach. It's data-driven decision-making so that everyone benefits. As we review the most recent assessment data to create strategies for the next 3 years, we take into consideration what has changed in the communities. Are there changes in available resources? Are there new methods to address the needs? We also rely on our partners who live and work in each community to provide helpful context on key people and organizations to work with, approaches that have been successful, and where there are gaps we might help bridge. A few examples of how we utilize our assessment data include: determine new ways to support equitable access to care for all children, expand parent support educational topics, develop a program to identify and remove asthma triggers in the home, strengthen oral health messaging for pregnant women, promote a healthy lifestyle curriculum, including gardening basics for children. We then recommend revised strategies to Cook Children's leadership. Once approved, we have a roadmap for the work we will lead or support in our communities over the next 3 years. Every year, we coordinate progress reports that outline the incredible work our programs and collaborations are doing to improve the health of the 1.2 million children in our region. Gathering this information from families, leaders, and partners is a fundamental element in our efforts to help each child reach their full potential. The overall process is definitely an investment, one that will serve our community well for decades to come. Thank you for the part you play in improving the lives of children and families. Visit our website to learn more.
Okay, Now it's my pleasure to introduce the Johnson County Alliance for Healthy Children chair, and her name is Kimmy Mcgrady. Keely has served as the Family and Community Health Agent in Johnson County, Texas A&M AgriLife Extension for the past 3.5 years. As a County Extension agent, she understands the struggle that families face with making healthy choices from day to day and strives to help residents of Johnson County learn that making small adjustments to their lifestyles can bring big health benefits to their lives. Keely has worked to achieve various certifications, including earning your Certified Food Manager license and completing trainings through FEMA and the Texas Department of Emergency Management to assist with disaster relief efforts around the state. She is passionate about the care and education of children, which has led her to co-chair the Central Texas Early Childhood Education Conference for the past 2 years. In her free time, Keely enjoys spending time with her family and friends, crafting and volunteering as a Sunday school and ladies Bible class teacher at her church. So, thank you, Keely, for being here.
Yeah, thank you so much, Dora. I'm very excited to be with all of you this morning, and glad that you all were able to join us today. So as Dora said, my name is Keely Mcgrady. I am the current chair of the Johnson County Alliance for Healthy Kids. And today I would like to take a moment to share some highlights of the work that the coalition has done in recent years. So in 2011, the Johnson County Alliance for Healthy Kids formed in response to the first SHAP survey results. And so in a nutshell, the coalition works to increase community awareness about childhood obesity and to promote healthy family lifestyles. So our vision is Johnson County, a community choosing healthy habits to build healthy generations. So the main strategies that we employ to carry out that vision include engaging Johnson County's community to improve children's health, providing and supporting healthy living education for Johnson County children and families, collaborating with Johnson County community leaders, schools, and service organizations to promote healthy living education for Johnson County children and families. And then we also monitor children's health issues to build healthy generations in Johnson County. So one major focus of the coalition is to support healthy lifestyle practices that evidence shows reduce the risk of childhood obesity. And we do this by offering 5210 education to the children of Johnson County. And so I want to tell you a little bit about what 5210 is and what that looks like. So this is a program that the coalition developed using an initiative from 2 national evidence-based programs, so 5210 and CATCH, which is Coordinated Approach to Child Health, and it's a 4-session program. So this is an evidence-based program that encourages kids to have 5 fruits and vegetables a day, no more than 2 hours of play screen time, 1 hour or more of physical activity, and 0 sugary drinks or 0 sugary beverages. So we combined the basics of this curriculum from both programs and worked with child life specialists to tailor it to our 3rd and 4th grade audiences. So when planning the program, we work with the schools to tailor it to their needs. So, for example, due to COVID, we worked together to adapt the existing 5210 curriculum by adding 15-minute lessons to our current offerings and virtually training facilitators so that we could ensure children continue to receive healthy lifestyle messaging. We also worked hard to add sleep to the 5210 curriculum, and we updated the program name from 5210 to 5210 Plus. So I'm very excited to pilot this new curriculum in the coming year. Now, since the conception of 5210, the Johnson County Alliance for Healthy Kids has provided over 115 hours educating nearly 4,000 children about 5210 and healthy lifestyles. Now, as a hands-on approach to teach wellness and healthy eating habits, we have also been able to partner with some of the schools in our community to help provide supplies for gardens. And the supplies include vegetable plants, fruit plants and trees, garden hoses, lumber and nails for raised beds, soil, and much more. And there are many benefits to school gardens, which include healthy lifestyle, academic achievement, and also environmental stewardship. So the coalition members have been able to support our partner organizations and events throughout the year. Oh, before I get ahead of myself here. There we go. I was like, I know I have more to say on gardening. So gardens are a great way to get kids involved in learning about nutrition, but also engaging them in physical activity. So children who are familiar with growing their own food actually tend to eat more fruits and vegetables, and are more inclined to continue healthy eating habits throughout adulthood. So gardening also encourages children to spend more time outdoors and less on screen time, especially play screen time. So we have also additionally added microgreens to our list of offerings. And microgreens are a very easy way to introduce children, families, and partners to gardening because they're typically grown in 10 to 14 days and then they're ready to eat. So they're getting to see the benefits of gardening and learning about gardening in a much more compact time. So thanks to the ongoing support from our coalition members, as well as our partnership with Dr. Rose at Hill College, we have provided garden supplies to establish and maintain 12 school garden projects within Johnson County. And those schools include Cleveland ISD Elementary Schools, and that's Adams, Coleman, Santa Fe, Irving, Girard, and Marty. The Alvarado ISD Elementary Schools, Lillian and Alvarado North. The Burleson ISD Elementary Schools, Hayek and Taylor Elementary. Also Godley Intermediate and Godley ISD. And we even have a charter private school, Joshua Adventist Multi-Grade School. So the coalition is looking forward to continuing supporting these schools and partners with their gardening efforts. Now I want to just turn to our efforts to engage the community and increase awareness about healthy lifestyles for children and families, and talk a little bit about how the coalition has adopted a number of strategies to do just that. So last year, in an effort to encourage children's resilience, the coalition collaborated with the author of a gratitude journal and United Way of Johnson County to adapt the content to align with our key messaging and meet community needs. So we provided support to community partners during the pandemic and in response to the winter storm to help ensure children and families had access to food, nutrition, education, and physical activity resources. So we have distributed over 52,000 nutrition and physical activity improvement tools and educational resources since the coalition's conception. And this includes education on healthy food choices, physical activity tools, and other evidence-based information to promote healthy lifestyles. Now, coalition members also support our partner organizations and events throughout the year, such as the BRIC, the Burleson Recreation Center, the Burleson Public Library, Joshua YMCA, Johnson County United Way, Harvest House, Texas A&M AgriLife Extension Service of Johnson County, Texas DSHS, Promises Community Ministries, and the Cleveland Public Library. So April is National Gardening Month, and the coalition makes a special effort to increase community awareness regarding the health and educational benefits of gardening for children. So with the support of our members and our community partners, We were able to provide 1,675 free microgreen kits with an educational card to Johnson County children. And we also assisted 5 partners with garden replants. So while April is National Gardening Month, we also recognize that September is Childhood Obesity Awareness Month. And so to bring awareness to childhood obesity and also the importance of living a healthy lifestyle during that month, we've partnered with area organizations to create a social media campaign and encouraged families to participate in healthy behaviors. Finally and lastly, the coalition celebrated its 10-year anniversary last year, which was a huge milestone and just speaks to the dedication and commitment that the Johnson County community has to improving children's health. Now, these accomplishments would not be possible without the wisdom, resiliency, and support of the members, leadership, and partners of the Johnson County Alliance for Healthy Kids. So if you would please just join me in thanking them for all that they have accomplished. We're very grateful for all of the work that these individuals have done and that they're going, continue doing in our community today. Every so often, we have the opportunity to recognize one of those members for their hard work and dedication to improving children's health. So at this time, I would like to turn it over to Courtney Bernard to do just that. Thank you, guys.
Thank you, Keely, and hi, everybody. I'm happy to be here with you all. Keely did a great job highlighting all of the things that the coalition has been working on in recent years, and knowing that there's a 10-plus year history there, and she's absolutely right. We always want to thank the partners and community members who come together to make this work possible. But every once in a while, we want to pause and reflect on who some of those superstars are and really deserve recognition. And so at the Center for Children's Health, we have what we call the Green Crystal Award. And this is given to community champions who have performed outstanding work on behalf of the coalition in advancing the objectives of Healthy Children 2030. And in the case in Johnson County through the coalition, we know that the 5210 Plus program and Gratitude Journal would not have been moved forward or would not have been implemented at the level it has been without one member in particular, their leadership and partnership. And so in Johnson County, we believe that the United Way of Johnson County is deserving of this recognition. And Allie Engstrom, their CEO and president, is here with us today to accept that award. But first, I'd like to really go through some of the contributions from United Way that led us to making this special recognition. So for those of you who are not as familiar with the coalition's work, United Way of Johnson County was one of the founding members of the coalition. So over the past 10 plus years, they've been actively involved with advising and leading and doing what United Way does, connecting the coalition with various community partners and creating those opportunities to promote the healthy lifestyle messages and advancing the coalition's vision and strategic plan. So in recent years, you heard Keely mention the Gratitude Journal and as one of the key successes of the coalition in recent times. And United Way played a very special role in getting this out into the community. They made it possible for the coalition to offer the school counselors, teachers, and other community professionals to provide this gratitude journal so that students and other kids in the community can be supported in their efforts to foster and build resilience. So not only did United Way pay for the licensing of the gratitude journal, they also worked hard to promote and distribute those journals to community partners. Another really key thing United Way has helped with in recent times is being a big champion for the key messages and the focus of the coalition. So connecting the coalition with other school leaders and creating those opportunities to share that 5, 2, and 0 in school garden education in with the schools. So having those opportunities to present at United Way school leadership events are really, really key to finding our way to those gatekeepers in the community. All of you who are here with us today, who work directly with kids and families to get this information out there. And so these connections made it possible for the coalition to expand its reach of the healthy lifestyle messaging to 480 students at Nola Dunn Elementary School. So that was a huge win. And those kids and teachers at Nola Dunn have been so grateful. And so, and I think I'll just kind of wrap up and say that United Way of Johnson County has always gone above and beyond to serve the coalition, and especially when Dora was new to us 3+ years ago as the Johnson County's coordinator. United Way welcomed her with open arms, provided office space, and gave her her own orientation of Johnson County so Dora could be familiar and be more effective in leading the coalition in Johnson County, so we could know all about the community from Allie's perspective. So just really, really huge contributions to the work of the coalition and establishing that foundation for this collaboration to happen. And we just wanted to really take the moment to thank United Way of Johnson County, Allie. I think they might be synonymous in this case here, but wanted to recognize you all with the Green Crystal Award. So Dora and Keely, would you all like to say a few words about why you all nominated United Way, and then we'll open it to Allie to say a few words.
I'll be happy to say a few words. Allie is a very passionate leader and has a great heart for the community of Johnson County, and thus represents the United Way as United Way's great heart and passion for the community. The board is, they're synonymous. They're all in one. They're all a wonderful package as far as not only a great resource for the community, but a great advocate and voice of the community. So it's an honor to work with United Way and with Allie.
Yeah, and I'll just add on, I mean, it's been wonderful working with Allie and with United Way. Their support has been just priceless to the coalition in the connections that they're able to bring in, and along with the support that they give and have provided in our programming efforts. So truly been a big help and a very outstanding partner in these efforts.
Mm-hmm. Allie, we so appreciate you being here with us today. We know you wouldn't miss it because you're always here with us. And I hope you take a minute afterwards to look through the chat at all the congratulations coming through for you. But would you like to share a few words?
Well, I don't know if all of you can see this, but this is our award, and we are so very proud of it. Need something really dark back there so that you can see. But this is never suspected that we would receive the award, but the board members that you see on the screen and the rest of our board they stand unanimously to support this coalition, with gratitude to Cooks, to Keely and her leadership, and Dora and her love and her kindness, all of the staff at Cooks. We even have another person from this county, and that's Sunny, Burgess, who does the musical thing there at the hospital. You know, without the people in Johnson County knowing and understanding that what all you do, and that's my job to get that information out there to them. But our children in this county are our most precious commodity. They're our future. So thank you for recognizing us. We're here 24/7. Every third grader in the county has my cell number. But we will always be here for you. And anytime there's a need. So thank you from the bottom of my heart. My board members were proud to be here that day, and they're very proud of the work that you do and that you allow us to participate in. So thank you. Thank you very much.
Thank you, Allie. Much gratitude to you and your team and your board. As always, you're just so eloquent, and we know you have a heart for the community and you get things done, and we love it.
Thank you.
So we'll lead into, with that good news, we will lead into the last segment of our summit today, and that is the group discussion. And you all saw the questions that Lauren posed to us right before the break to help us make connections between the data you heard and connecting it to what you all see in your day-to-day real life in Johnson County. And so a poll question just popped up. We're going to start off by polling all of you, and we'd love to hear from you that based on the data presentation you just heard, what resources are available for families in Johnson County related to healthy lifestyles. And you have a couple options on the screen, and it sounds like it's multiple choice, so you can, if you like to choose all of them, you can choose which ones are most relevant, you think. And while you all are answering the poll, I am going to invite Blair and Lauren and Dora to share some of their comments to get us going. And then we'll turn to you all in the chat and to unmute to share more. So Blair?
I like seeing the behind the scenes results of these polls. It's, you know, as a data person, it's always fascinating to see data collected in real time. From the data, there's pretty good evidence that all of these things are needed, not only in Johnson County, but in every county. The core of all of it just comes down to the basic needs, that food and safe, stable housing. While most kids in Johnson County have it, for those that don't, that certainly impacts not only their healthy lifestyles, but it affects their health and their environment and their learning, and even parenting and family support. So certainly is a key root there.
Mm-hmm. Lauren, anything to add?
Mm-hmm. Yeah. So based on what Blair presented earlier too, just to kind of elaborate on that, you know, there's also an importance with having a medical home and receiving those well-child visits. I think Blair talked a little bit about the importance of those developmental screenings and things like that. And so it's really great to for families to have that open dialogue with their providers and then receive some of that wellness education and those resources related to nutrition, which obviously the coalition does a great job of doing, and that's why you all are so pivotal in making our work happen. And so I don't want to speak too much more to that, but I know, Dora, you can probably talk to some of those impacts that the coalition has had as well.
Well, that's one of the things I know Judge Harmon mentioned it earlier in his thank you about the fact that there are a lot of people in Johnson County that are giving to the community of their time, volunteering to support the community. And the work that the coalition is able to accomplish is done with that the same giving community that Judge Harmon mentioned. They are the ones, our members are the ones that help move the goals forward. It's their leadership. And so when I was looking at the poll, there are wonderful parks and trails and resources in Johnson County, and those are the people that are at the table, working with us. Same thing with the libraries. And so organizations, it's everyone working together to get these resources, or we have wonderful champions that we're working with.
And I'll add, I didn't scroll down enough in the poll on my own screen to see that there was the choice for other. And so if you have thought of other resources in Johnson County related to healthy lifestyles, please put that in the chat. And I'll note here that we'll, since we are recording this summit, we're able to save the chat as well. And so any resources or conversation that we're having in the chat that you don't want to lose, we'll be able to save that and send that out afterwards as well. So for those of you who chose other or have other thoughts of what resources, please feel free to put in the chat. In the meantime, we will move on to our second question. So let me stop sharing here. And that is based on the children or families that your organization serves, what types of community resources do families need the most? And are there collaboration opportunities for providing and sharing these resources? So it's a two-part question, but we'll start with what types of resources do families need the most? And again, I don't have to scroll, so I see the other there. Please put in the chat. It looks like you can only choose one answer. So again, if you're like me and like to choose multiple things, you can put some more responses in the chat. But again, while we wait for the results, Blair, what did you find were the most common responses to this question in the CHNA data?
That's a great question, Courtney. And while all of them are common responses, I think pandemic played a role in what would be ranked as number one. And for many, that access to those basic needs might be more of a priority. Whereas before and even during the pandemic, some family resources for families around mental health or helping with ACEs if they have any adverse childhood experiences, that was also helpful. But that parent and family support is really key to everything else. And so in having those lines of support for families and caregivers so that they can access the helpful resources in the community or have the knowledge of where to go to get healthcare, or there's many, many, many great resources for physical activity in Johnson County, either just various events or parks and areas where families can safely play. But just having that knowledge of that they're there and they're available. And in many cases, some are free or fairly affordable. Lights off. See, this is another physical activity opportunity. Is lights just go off and then I have to wave my arms about in order to turn the lights back on.
It's your built environment.
Built environment. There you go. But to the point is there are a lot of resources in Johnson County and there's a lot of great organizations that have recognized these needs. But it's just bringing those families to them in some cases so that they can utilize them.
Yeah, and I'll say in the poll question here, I just shared the results with you. We always know that access to basic needs is always a need and a priority for communities everywhere. But it's interesting for me to see you all select family resiliency and parent coping information as well as the second and third response choice. And so if you work in that space or if you have observed that in your organization, I'd invite anyone to either mention it in the chat or feel free to unmute and share more. Because it helps us build that picture of what life is like for families in Johnson County. And while we wait for folks to add their thoughts in the chat, I'll go ahead and work on that second part of the question, and that is, are there collaboration opportunities for providing and sharing these resources? So where are those avenues within the county where this collaboration to get these resources to families, where is that happening? We've already known about the Johnson County Alliance for Healthy Kids, United Way's role in connecting, but where else?
There's also the Johnson County Resource Network. Is anybody present from that group that would like to share what they're doing, their meetings?
I saw someone else, I believe, from REACH, and I know that's different, but there's also the REACH Coalition as well, right?
Yes, the REACH. There's somebody from REACH as well. Oh, there's a comment on here from
Sharice with Re-Inspire. Yeah, would you like to unmute and share more? We'd like to hear about your resource center.
I actually unmuted to talk to you about JCRN, the Johnson County Resource Network. I'm one of the, so I'll talk on that first. I'm one of the facilitators. There's 4 of us, and I saw others' names here too, so I was waiting for them to chime in. But so the Johnson County Resource Network is available for any local agency or organization, and we have just revamped our format. We went back to in-person meetings after 2 years in April, which was very exciting. And then we took a survey there. So our next meeting will be in September, and we're moving to a quarterly format. So it'll be September, December, and then so forth. And that meeting usually includes lunch and then some sort of informative speaker, whether that be to let us all know about new services or something new happening, or also something more generic like social media for nonprofits was a topic we did. So it's the speakers can really vary, and we just really wanted it's also a great opportunity for networking. So you'll see a lot of agencies like, oh, I need to talk to that person because they have something that they can build together with their different programs. So that's and that meeting happens, like I said, we're kind of changing. So the next 2 meetings will be in Cleburne, but I believe we're planning to, I don't want to speak to the other, Dana, I know you're in this meeting, so if you want to jump in, but the other facilitators, I think, might be moving their meetings around to different locations in Johnson County, just so we really are countywide. I don't know if anybody else wants to talk.
That's fantastic. Well, we can also put that in the chat. If someone has from the resource network has the main contact information, please put that in the chat. Like I said, we're saving everything shared in the chat, so we'll be able to send that out too. And then people can get the updates on your meeting times. But I love that idea of having the different locations, especially in a county spread out like Johnson County is. That's a great idea. And I see Nikki, thank you for offering in the chat too, to talk about REACH across Johnson County.
Hi, everybody. So REACH across Johnson County, we're a new coalition. We've been around 2 years, but with COVID, it's, been a big transition just to kind of get our feet wet again. But I have really seen a takeoff in 22 for us. We have coalition meetings once a month in different parts of Johnson County. So last month was was Alvarado. This next one we're going to have on June 16th in Cleburne. But a little bit about REACH. Our main mission is just to help the community spread education and awareness about, prevention, drugs, alcohol, and vaping. We do several different things to make that happen. We have a radio show on Wednesday nights where we brought people in from Cook Children's. We bring in different doctors in the area, different addicts, different other resources. So if there's anybody on here that would like to come and speak about your community or what you're doing for the community, or if you have anybody that you think would be great on the radio show, please let us know. That's Wednesdays at 6, or Wednesdays at 5, sorry. Mm-hmm. And you can go back and hear any of our different radio shows that we have. We work in all the schools in Johnson County. So, well, not all the schools. We are in Cleburne, Burleson, Alvarado. We're about to be with Dead Red Ribbon Week there, but we're not like doing curriculum there. But the amazing thing about our education piece is we have different programs. So we have one program that's called Kids Connections, and we meet with kids that the counselors have decided that really kind of need an extra mentor, and they're pulled out one day a week for 10 weeks, and they just get to meet with the other kids in their grade that have been pulled out. These kids really enjoy it, and I used to do this before I was the coalition coordinator, so I know how much those kiddos love to come see their mentors or their that prevention specialists that have them. They get to come and learn just about making healthy choices and bullying and peer pressure. And then as they get older, it transitions into a life skills program. And that's for our 5th graders that are entering middle school. That's a little bit more in depth. It's, I think, 8 weeks. But in that program, they start talking about nicotine and vaping and just the things that we know our kiddos are seeing, but they might not be having those hard conversations at home. And the best thing, you know, on the prevention side is to talk to kids when they're young and to give them education, because kids love to hear the facts. They love science, and they listen to that whenever you're letting them know about it. So if you know of any schools or anybody that might want those programs, please let me know, and I can get you in connection with our director for education at REACH. We also do. We also do educator presentations. So like for schools going back in the fall, we're going to work, especially with COVID. And we're, you know, like we said today, there is so much just social anxiety, and the mental health is on a rise. And if we don't help parents, then we know they're turning to drugs and alcohol as well. So just to be teaching them different coping ways. And then one more thing, I mean, there's so many other things about REACH, but I would love for y'all just to, I'm going to put my email in the box. If you would love to come to our next meeting, I would love that. We've also got COVID funding right now. So we're in different areas of Johnson County. We just helped the ASD Center in Burleson with their playground. The way the COVID funding looks is we're just going in and trying to help do things that will be sustainability for the future, but things that are bringing the community together. So we are helping Alvarado maybe with the 4th of July event coming up, and we've been helping Burleson in different ways. So if there's any ideas there, I would love to hear them. And then one more thing, October 8th, we are partnering with another agency in Burleson, and it's going to be called the RISE Conference. And this is all about mental health. It's free, so put that down. Y'all be hearing more about it on social media soon. But there's going to be speakers all day at this conference. It's going to be at the Pathway Church. There's going to be food trucks there, and then there's going to be different stress sections where you can go and basically build your own stress kit. So there'll be oils, and there'll be bags, and there'll be like different, you know, journals to be able to journal and do manifestations and just things to teach people different ways to cope, but they can go and make their own that fits their needs. And there'll be breakout sessions about Enneagrams and yoga and all of that. So we are so excited to do this for Johnson County because it's free, and it's for males and females, because we want males to understand that we know that they also struggle. And we're just excited to see what this does for the community. So thank y'all for letting me share.
Thank you, Nikki. REACH sounds like an incredible resource, and I'm so glad you're on the call to share about that. Please do put your information in the chat so others can get connected with you. We only have 4 minutes until this event wraps. And Georgie, I see your comment in the chat. So if you have like a one-line highlight you'd like to share with everyone, and put more in the chat, and we can connect afterwards to get more information out. I don't want to leave you out of this conversation. So Georgie, I'll hand it over to you, and then we'll wrap up the summit today.
Awesome. Thank you so much. So I'm Georgia Martinez. I work for Pecan Valley Centers, and I have my coworker Zana here. She's hanging out with me today. So she makes a little noise. I'll be quick. So System of Care is a grant that was awarded to Pecan Valley Centers. And so it's something new that we're doing. And basically, it's a community collaboration where we're wanting to support children, youth, and young adults that are at risk for mental health and related challenges. And we want to do that by, organizing into coordinated networks, building meaningful partnerships with those family and youth, and then also addressing cultural and linguistic needs. And so we are in the process of beginning our governance board in Parker County, and then Johnson County is our next county. So we're really looking for people who might be interested in being a part of that.
Thank you, Georgie. And when you have a free hand, put your stuff in the chat, but we know how to reach you because we've been in talks with you in other locations. So we'll make sure to get your information out. Thank you all for this incredible discussion. Because of the time, I'm just going to wrap up my part and send it y'all over to Lauren.
Thank you, Courtney, and thank you all for sharing your thoughts with us. I always love this part of our summits. It's just so great to hear about all the resources and things that you all have available and that you're doing in Johnson County. We really appreciate your support for the Center for Children's Health and for the Johnson County Alliance for Healthy Kids, because you all play such an important role in improving the health of Johnson County children every day. You'll see here on the screen a QR code. We'd love to have your feedback for today's event. So I don't want to take up too much of your time, but if you'll spend maybe the next minute or so trying to fill out that survey, we'd greatly appreciate it.